Hi, my name is Caroline DeGroot, and I'm a physical therapist with Illinois Bone and Joint Institute. Today, I'm going to be instructing my patient on some exercises for stretching of the low back. The first exercise I'm going to be instructing my patient on is called single knee to chest stretch. The first thing I'm going to ask her to do is put your hands behind the leg, and you're going to gently pull your leg in towards your chest until a comfortable stretch is felt. You're going to hold that stretch for a count of 20 seconds and then slowly release the stretch. Now I'm going to have you do it on your other leg. Again, pull in, hold for 20 seconds. No pain should be felt in your low back. And then you're going to put it back down. This exercise should be repeated 3 times on each leg, held for 20 seconds. The next exercise I'm going to be instructing my patient on is called trunk rotation. What I'm going to ask her to do is keep your knees together, and you're going to slowly bring your knees towards me in a pain-free range of motion. You should feel a gentle stretch in your low back, but no pain. Now I want you to feel that you're activating your abdominals to try and pull your legs back up, and then you'll take your knees to the other side, again, in a pain-free range of motion. You're going to hold for 5 seconds, activate these abdominals, and bring your knees back up. You will complete 10 repetitions of this exercise, holding each side for 5 seconds. The next exercise I'm going to be instructing my patient on is called a pelvic tilt. In this exercise, I'm going to ask you to slowly engage your gluteals, the buttock muscles, to try and press your lower back into the table. You should feel your low back press into the table. You're going to hold this position for a count of 5 and then relax. During this exercise, I want you to gently engage your gluteals and try and press your low back into the table. Some common mistakes people make during this exercise is lifting their bottom off the table. I don't want you to lift your bottom. I want you just to gently tip or rock your pelvis backwards, feeling your low back press into the table that you're lying on. Hold that position for 5 seconds and then relax. This should be a pain-free range of motion in your low back. You're going to do 10 repetitions of this exercise, holding each repetition for 5 seconds. I'm instructing my patient on a stretch for the low back, which is called a seated flexion stretch. I'm going to have you sitting in a chair. You're going to slide your hands down the outside of your legs towards your ankles. Grasp your ankles until you feel a gentle stretch, pain-free in your low back. Hold this position for 10 seconds, and then slowly slide your hands back up your legs and relax. You're going to repeat this 10 times, holding each repetition for 10 seconds.